Hi, my name is Carson Engesser. This is my informative speech on genetic and non-genetic mental illnesses. Raise your hand if you have dealt with a mental illness or experienced struggles with mental health at any point in your life. Based on all of the hands I just saw, most of us in the room have had some type of issue with mental health and struggled. According to the National Institute of Mental Health, more than 1 in 5 adults in America struggle with mental health daily. According to this chart I have right here, anxiety is our number one leading mental illness. 41% of Americans struggle with anxiety. Obviously, mental illness and mental health are a big deal in today's society, but not a lot of people are educated on the different disorders and illnesses that can go around. I have struggled with anxiety, depression, and ADHD for most of my life, but it wasn't until just a few years ago that I started learning about my mental health and how to manage my mental illnesses in a healthy way. Today we will be looking at mental illnesses that are passed down genetically and then mental illnesses that are brought on by trauma as well. First, we're going to look at some mental illnesses that are passed down genetically. Today I have 3 mental illnesses that are passed down genetically, and we're going to start with autism. Autism is a neurodevelopmental condition that varies in severity, but it lasts a lifetime. It can be recognized in early childhood. Usually it is. Most often, though, it is characterized by difficulties with social interactions, communication, restricted or repetitive patterns of thought and behavior. Autism is a gene malfunction as well as a lack of brain development in some areas. While the brain is developing, there are usually more neurons and more overgrowth in parts of the outer surface of the brain, while there are also patchy areas in the cortex which disrupt the brain. This usually happens in the frontal and temporal lobe, where things such as emotions, language, and social behavior are found. This is why people with autism sometimes don't talk at all or struggle with explaining what they're thinking. There's a lot not known about how autism is passed down. People are saying that people with the gene changes that are associated with autism are more likely to inherit and increase risk of developing the condition, meaning that the child can develop autism because his or her parents had a certain gene that changed the way that when they came together changed the child's outcome. My second mental illness is bipolar disorder. It is a mental illness that causes extreme mood, behavior, and energy shifts. There are subcategories called bipolar 1, bipolar 2, and psychosomatic disorder. Bipolar 1 involves manic episodes, psychotic symptoms, and depressive or hypomanic episodes. Bipolar 2 involves hypomanic episodes as well as depressive episodes. Psychosomatic disorder is less severe in hypomanic and depressive episodes than bipolar 1 and bipolar 2. There isn't a lot known about how bipolar disorder is passed down either. It is a gene malfunction, but no one knows how the genes malfunction, why they malfunction, or even which ones exactly malfunction. Some genetic mutations associated with bipolar have also been seen in other mental illnesses, such as schizophrenia. We still don't know why bipolar is prevalent in some families and less in others, but we do know that it is most likely to be passed down in the first-degree relatives, such as a mom passing down her bipolar to her child or to a sibling. People with bipolar disorder are also more likely to have relatives that struggle with psychotic, mood, and anxiety disorders. Our last mental illness that is passed down genetically that we will look at today is attention deficit hyperactivity disorder, also known as ADHD. ADHD is a disorder in the brain that causes people to struggle with concentrating, acting on impulses, and being restless. There are 3 different types of ADHD: combination, hyperactive, and inattentive. As I stated before, I have ADHD. I have combination ADHD, which is, just like it sounds, a combination of hyperactive and inattentive ADHD. It is the most common type of ADHD. Hyperactive ADHD is found more often in males, and it is also the least common. type of ADHD found. It can look like struggling to stay still, quiet, constantly fidgeting or moving, talking, interrupting others, and unable to stay focused on one task at a time. Inattentive ADHD is more common in females. This usually looks like difficulty listening, daydreaming, forgetfulness, being unorganized, and a short attention span. ADHD is usually passed down from parent to a child, but studies are showing that genetics might not be the only reason some people have ADHD. There are studies looking at brain development in ADHD brains, and it's showing that people with ADHD could have an imbalance in neurotransmitters or chemicals that might not work properly in the brain. Premature infants that are born younger than 37 weeks are more likely to develop ADHD, as well as infants with epilepsy or brain damage. If you develop brain damage in life and it is severe enough, you can actually develop ADHD later in life. However, this is very, very uncommon. So those are just a few mental illnesses that are passed down genetically. Now we're going to look at some that are brought on by trauma. Again, I have 3 mental illnesses that I researched. Our first one will be post-traumatic stress disorder, also known as PTSD. PTSD is a mental illness that is brought on by experiencing or witnessing a very terrifying event. Having PTSD includes having flashbacks, uncontrollable thoughts about the event, nightmares, and severe anxiety. This illness is controllable with time and good self-care. When someone is first diagnosed with PTSD, it's usually very hard for them to adapt, but as time goes on, it does get easier. Symptoms can increase and decrease in intensity as well, so some months might be really easy and some months will be harder. Symptoms can also start as early as 1 month after the event, but sometimes they don't show up until years after the event. So it will feel like it just randomly came onto you, but really it's happening because of an event that happened years before that you might not even remember or think much about now. So our symptoms are put into 4 groups. We have intrusive memories, avoidance, negative changes in thinking and mood, and then changes in physical and emotional reactions. Intrusive memories can look like reliving the event all the time in our head, having nightmares, being triggered by something that reminds you of the event. And then avoidance can look like avoiding certain places or people, and it can also look like shutting your brain down completely and just not thinking about the event at all. Negative thoughts and moods can be recognized by someone having negative thoughts about themselves, the people around them, or even just the world as a whole. They can also feel a sense of hopelessness, a lack of interest in the activities that they used to enjoy, and difficulty experiencing positive emotions. A lot of time they will feel numb. So changes in physical and emotional reactions are also them being aware of possible danger, not just when there is actual danger, but just day to day. They're constantly worried about the danger that is around the next corner or whatever. They also have trouble concentrating or sleeping. They feel an overwhelming shame and guilt. They also have anger outbursts, and sometimes they can even have aggressive, dangerous behavior. PTSD can be caused by lots of things, being threatened by a weapon, fire, robbery, obviously sexual assault and combat fire, terrorist attack, or even sometimes a medical diagnosis. Without help, PTSD can increase the risk of substance abuse, the chance of an eating disorder, and suicidal thoughts or actions. But most people go on to live a somewhat normal life with the right help and resources once they get diagnosed with PTSD. A lot of the help that people use is going to their family and friends for support, seeing a medical professional, going to therapy, or sometimes they even find a community of faith that they feel comfortable with. Our second mental illness is depression. It is a mood disorder that causes a shift in how someone thinks, feels, sleeps, eats, and works. Anyone can have depression, but women are more likely to be diagnosed with depression because they speak up about their emotional symptoms, while men usually only look at the physical symptoms of this disease. There are 5 different types of depression: major depression, persistent depressive disorder, prenatal depression, seasonal affective disorder, and depression with symptom of psychosis. So major depression is symptoms of depressed mood or loss of interest for at least 2 weeks, sometimes more, but it's usually around that 2-week mark. Persistent depressive disorder is has less severe symptoms, but it lasts much longer, usually lasting about 2 years, sometimes longer, sometimes shorter. Prenatal depression is depression that occurs during and after pregnancy. Seasonal affective disorder is a depression that comes on during a specific season, usually starting in late fall and then ending during the spring or the summer. Depression with symptoms of psychosis is a severe form of depression where someone experiences delusions and hallucinations. Depression has lots of symptoms and mood changes that can help someone get diagnosed. Symptoms are feeling of hopelessness, irritability, frustration, restlessness, decreased energy, thoughts of suicide, becoming withdrawn, and an increase in use of drugs and alcohol. Again, not everybody has these same symptoms, so it is important to talk to a professional if you or someone that you know might be struggling with depression. There are also multiple different treatments for depression. Medication is one that is very common. There are lots of different antidepressants that you can look at and use. But some other treatments are psychotherapy, which is talk therapy or counseling. It's just another way to get your depression under control, and a lot of the times psychotherapy and medication are used together. Lots of insurances cover psychotherapy, and there are many, many different counselors that you can look into, so you can find one that works for you. Another thing to look into is brain stimulation therapy. It's another option. It's less explored, and there are a lot of experimental experiments going on, but there have been a few that have been approved by the FDA, so that's always something that you can look into. If you are looking for help with your depression, it is best to research all of these and find something that will work for you, because what works for me might not work for you as well. So our last disorder to look at is reactive attachment disorder, also known as RAD. This disorder is when a child doesn't form a bond with his or her parents or the primary caregiver of the kid. This disorder is extremely rare. It's only diagnosed in children between the ages of 9 months and 5 years old. These children can be irritable, sad, fearful, have a hard time interacting with other people, and also they are not comforted by adults. This disorder usually occurs in children that have been extremely neglected and extremely abused. So a child will only be diagnosed with RAD if a doctor sees that he or she has no bond with a parent or caregiver, they have experienced extreme neglect and abuse, or they have had multiple changes in caregivers. The doctor will also make sure that the child doesn't have autism before saying that they have attachment disorder. So symptoms include not smiling, them being irritable for no reason, not reacting when being picked up by an adult, having no interest in people around them, not being calmed down when an adult is trying to calm them down better, being calmed down better by themselves. And they also don't play interactive games such as like peekaboo or other things like that. They just are not interested in that. This disorder can be treated and usually cured because they are so young. Treatments include going to individual and family therapy. Parents are also go to a training to help them bond with their child. And then there are also educational services that help the kids stay on track in their education while still going through the treatment. Once they're treated, most kids don't continue to struggle with the attachment disorder. However, there is a higher risk for other disorders such as eating disorders, anger issues, depression, anxiety, sometimes developmental delays, and even physical growth delays, and then also drug and alcohol abuse. So as you guys have seen today, there are many mental health disorders that are passed down genetically, and there are just as many that are brought on by traumatic events. mental health is very, very important. It's good that we stay educated on our own mental health and just the mental health of our world because we are going through some tough times. So if you or someone you know is struggling, I encourage you to talk to a professional to get help to improve your life for yourself and the others around you. Thank you.